Mom, my ear hurts.
Oh, I'm sure it's fine. It'll go away.
No, it's like serious. Like it really hurts.
Are you sure?
Yes.
Alright, I guess we'll have to take you to the doctor then.
Mom, it's getting worse. It really hurts.
What are you talking about? Your ear?
What?
Your ear.
Yeah, it's really hurting.
How's your skin? Is it still itchy?
Yeah, I'm starting to get bumps everywhere.
Oh, that's not good. We better get to the doctors fast.
Yeah, I know.
Hello, I'm Dr. Aranda.
Hi, I'm
Dr. Aranda, Jonathan. Now, what brought you guys into it?
So Jonathan here, he's been having a lot of like skin blotches and like it feels bumpy, and then he's had like a ton of ear infections, and he has something, I think it's like a hernia, but I'm not sure. I think we have to get that
That's
looked at.
very serious. How long has he had these symptoms?
Well, as you know, he's been diagnosed with a mental disability.
Yeah, I see it on the records.
Yeah, and these just started appearing around like 2 months ago.
Yeah, we're gonna definitely have to check out that hernia, and we're gonna run blood tests and a urine test.
Yeah, that works. 1 week later.
Welcome back, guys. As you know, I said I was gonna take a blood and urinary test. The blood test came out fine. The urinary test, we found mucopolysaccharidosis type 2.
What's that?
It's also known as Hunter syndrome.
What's Hunter syndrome?
Well, Hunter syndrome, aka mucopolysaccharidosis type 2, is a metabolic disorder where the specific lysosomal enzyme is absent, aka iduronate sulfatase. Iduronate sulfatase breaks down hepatin and dermatate sulfate. Since iduronate sulfatase is absent, it leads to the buildup of these molecules. Hunter syndrome is most commonly found in males. It is an X-linked recessive disorder. The symptoms can cause recurrent ear infections, enlarged liver and spleen, and abdominal hernias. Later symptoms of Hunter syndrome include prominent forehead, flat nose, bridge, enlarged lips, tongue, and gums, thickened heart valves, and obstructive lung disease, which is near the heart, stiff joints, making it hard for them to move, short stature, and skinny, tiny pebbles, making their skin bumpy. Severe cases include ADHD, autism, OCD, general aggression, and mental disability.
But doctor, how am I supposed to fix this? He's in severe pain.
There are many different ways that you can make him more comfortable and work with his pain. You can have surgical corrections for his hernias, a heart valve replacement, respiratory support to help with his lung disease, speech therapy to help with speaking and improve on his autism, and hearing aids so then he can hear better. To deal with more severe cases, you can have enzyme replacement therapy and bone marrow transplantations. We took a urine sample from Jonathan, measured his glycosaminoglycans in his system, and noticed that there was a lack of enzyme activity. This lack of enzyme activity is due to an absence of iduronate sulfatase in his lysosomes. Without the iduronate sulfatase, the lysosome can't break down carbohydrates like heparin sulfate and dermatin sulfate. With the buildup of these carbohydrates, you see the symptoms of pebbled skin, autism in the case of Jonathan, and other things like his hernias and his ear infections. The treatments that you can use are the ones that we talked about before, like the speech therapy and the surgeries to remove the hernia. But you can also use the enzyme replacement and the bone marrow transplantation. Because of his condition, Jonathan's life is going to be very tough. He's going to be going through a lot of pain. You're going to need to see many specialists and maybe a surgeon to get his hernia checked out, because if it is a hernia, that is going to need to be removed.
Yeah, I was planning on that.
And sadly, Hunter syndrome will limit his life to about 10 to 20 years.
Well, thank you, doctor. Much appreciated. Thanks for the info. And yeah, I'll see you.
And make the appointments with my receptionist,
Yeah.
the specialist.
Of course.